In this video, I'm going to demonstrate taking a patient's vitals. The first thing you want to do is introduce yourself. Hi, my name is Christine. I'm going to be the MA working with you today. Can I get your first and last name?
Stephanie Riff.
Perfect. Can I get your date of birth?
6/7/88.
All right. After verifying the patient's identity and their date of birth, go ahead and document that in the patient's charts. And now we're going to proceed with the procedure. The first thing I'm going to do is I'm going to take your temperature. Now we're going to be using an oral thermometer. Now this has a disposable guard on it, so this will be thrown away after the patient is done taking the temperature. So go ahead and open your mouth. Go ahead and lay it on your tongue. You can hold it for me. Leave it in there for a couple of seconds. All right. After getting the patient's read, we're going to go ahead and dispose of the cover that goes over the thermometer, and then we're going to document the temperature in the patient's chart. And you had a 97.8, which is really good. Now we're going to proceed with taking the blood pressure. So I'm going to have you put your arm right here and relax it. And you want to make sure when you're grabbing the blood pressure cuff that the arrow is pointing down towards the artery. That's how you know the cuff is on correctly. And you want to make sure that you put this on nice and comfortable. All right, how do you feel?
Fine.
All right. Here we go. Now, in taking the blood pressure, you want to make sure that you don't cover the back of the stethoscope, because any finger on top of this can actually create a different pulse, and we don't want two pulse rates while you're taking your blood pressure. So you're going to go ahead and hold the stethoscope like this, place this right here on the artery, and we're going to go ahead and pump it till about 180. And then you're going to release. All right. Sounds nice. After you get the blood pressure, you're going to record that in the patient's chart. And your blood pressure was good, about 125/82, which is very normal. Now I'm going to take your pulse, so can I have your wrist? I'm going to have you cross it over your chest. Now I'm going to take the patient's pulse read and her respiratory read at the same time. By having her cross her arm across her chest, I can actually see her breathe in and out, and I can count her respiratory rate and take her pulse. So you're going to start at the 6 on your watch, and you're going to count for 30 seconds, and then you're going to times that times 2. So I'm going to start now. All right. After you're done with that, go ahead and record the patient's vitals in their patient's chart and have them go ahead and take a seat. The doctor's going to be right with you. Thank you for watching. Have a good day.